Hey everyone, welcome back to Anatomy Lab. This week we're going to look at some other structures that you can also find in the upper extremity. So if we start proximally right here at the shoulder, let's look at some of the nerves that you'll be expected to know in lab. So the nerves that we're going to find right here in the shoulder originate in the brachial plexus. The way that I like to identify them best is by looking at a superficial set and then a more deep set. So let's look at the superficial set first. My mnemonic for these is MMU. So I always like to take my own hand and place that either in my axilla or the axilla of the model or the axilla of the cadaver. And like I said, it's MMU. So this first nerve that we're going to look for is the musculocutaneous. The second M of that mnemonic is the median nerve. And then the last one is the ulnar nerve. So we want to look for this M structure with this model right here. We can do it with Vinny. It's a great place to look for it as well on the cadaver. So let's look at this musculocutaneous and follow it down a little bit more. So here it is, and if I lift up the biceps brachialis, the biceps brachii, we can see this nerve continue here to the brachialis. And this makes sense because both of these muscles are innervated by the musculocutaneous nerve. If we head to the next one, the median, this is a really great landmark to find because it runs all the way down to carpal tunnel. So if I remove these muscles of the forearm, and we can literally follow this underneath the flexor retinaculum, it goes under the carpal tunnel. So it's a good one to find, a nice easy landmark, arguably the longest on this model. And then the next one, this last one of the superficial set for this U, is the ulnar nerve. So it's going to be closer to the ulnar bone. That's how I try to remember it. You also want to see this muscle disappearing right here at the elbow. So when you bend your elbow or you flex your elbow, that exposes the backside of this ulnar nerve and you can hit it on the table, and that's responsible for that funny bone sensation. So I always try to find this one. It's a great landmark on the cadaver to look for as well. So in addition to knowing the muscles that these nerves innervate, you're also going to be responsible for the skin sensation. So be sure to check your lab manual for those. All right, so the last two set of nerves from the ones that we have to focus on coming out of your brachial plexus, these are going to be a little harder to find on this model, but these are going to be a little deeper. So if we think about maybe removing that M, the next set look more like a V, and those are going to be your axillary nerve and your radial nerve. So on this model, the axillary nerve, if I put this deltoid back, right, when we kind of rotate it and we pull the deltoid off, we can see the axillary nerve on this medial aspect of the arm. And this makes sense if we think about it. The axillary nerve is just responsible for innervating your deltoid, so you would only find it in the same region where you would find your deltoid. The other nerve that we're going to look for is the radial nerve. So this starts underneath or deep to that M. Here we see the radial nerve diving in between some of the muscles of your rotator cuff. And if we rotate the arm posteriorly, we can then follow some of the radial nerve as it heads towards the posterior aspect of your forearm. So the radial nerve is in charge of innervating all of these muscles on the posterior aspect, right, like your triceps brachii, as well as the skin sensation to the posterior forearm. Okay, so let me put this muscle back a little bit here, and let's head down to the forearm. So something else I wanted to go over is the flexor and extensor retinaculum. So this is a band of tendon-like tissue that goes around the wrist on both sides. So if it's on the anterior aspect, we call it the flexor retinaculum because it's on the same side as all the flexors. If we're on the posterior side, we call it the extensor retinaculum because it's with all the muscles that help to extend the wrist. It's the same structure though. You can literally follow it all the way around. It's in the same place that you would expect a wristwatch to be. To help me double check that I'm in the right place, I always look for palmaris longus, or the tendon of palmaris longus heading forward to the palm. In some of the other models, you might be able to find your palmar aponeurosis. So this is just a broad tendinous sheath that can be found here on some of these models in the hand. You can also see it on the cadavers usually. So that's a good landmark to try to find as well. Back to our arm again. Let's check out some of the blood vessels that we'll find here. So if we head back up to the shoulder, this big red one is the brachial artery, and it is taking blood away, right, because it's an artery. And if we follow it till it splits, or it branches into two more arteries that you're responsible for, and those will be the radial artery and the ulnar artery. So I always try to remember that the radial one is on my thumb side and the ulnar is always going to be on the pinky side, and we can follow those down to the forearm. Okay, I think that's it for other structures that you'll find this week. Thanks for studying hard, and we'll see you again soon.